Hello, I'm with High Point University. I'm a student in the grad school for physical therapy in North Carolina. Our students, faculty, and staff thought it would be a good idea to create a video with some respiratory exercises and additional information for COVID-19 to spread some awareness. When practicing some of these techniques, make sure that you are using gloves if you're doing it with another person. And you can do all of these in your home without any additional devices.
I'm going to be explaining a technique called huffing to help clear mucus from your lungs. Huffing is a gentle way of coughing and can be performed at a low level and a high level. The low level clears mucus from the small airways and moves into the larger airways, whereas the higher level moves the mucus from the larger airways out of your lungs. We suggest doing 3 repetitions of the low level huffs followed by 3 repetitions of the high level huffs to clear the mucus from your lungs. For the low-level huff, slowly inhale through your nose and hold it for 3 seconds. Then force the air out of your mouth by using your abdominal muscles and maintaining an open airway by keeping your mouth in the shape of an O until there is no air left in your lungs. I'm now going to demonstrate this for you. Perform this 2 additional times. For high-level huff, slowly inhale in deeply through your nose until you can't breathe in anymore. Then sniff once to take in any remaining air. Hold your breath for 3 seconds while maintaining an open airway, and perform a quick, short exhalation, expelling all of the air out of your lungs at once. I'm now going to demonstrate this for you. Perform this 2 additional times.
In instructing patients how to perform diaphragmatic breathing, it's important to start in the hook-line position. From there, place one hand on your chest and one hand on your stomach. As you inhale, you'll feel movement under both hands. It's important to realize which hand you feel more movement under. If you feel more movement under your chest hand, that means you're using your accessory muscles to help breathe. If you're feeling more movement under your stomach hand, that means you're using your diaphragm to inhale. And that is the correct mechanism in which to perform inhalation. As you lay here, try to draw in a deep breath. Try to draw that breath deep down into your stomach and try to limit the movement you feel under your chest hand. On exhalation, you're going to want to make kissing lips to facilitate pursed expiration.
The purpose of pursed-lipped breathing is to expel more air so that in turn you'll be able to take more oxygen in to your lungs. Kim is demonstrating pursed-lipped breathing. For this, you will breathe in through your nose for 2 seconds and then breathe out through pursed lips as if trying to blow out a candle for 4 seconds. Do not blow out the candle with force.
Today, Michaela will be demonstrating autogenic drainage. In order to do this, you'll place one hand on your chest and one hand on your abdomen, making sure with each breath in to breathe forcefully through that hand in the abdomen without moving the hand on your chest. To start this exercise, you will do 10 to 20 small breaths in and small breaths out. After this, you will do 10 to 20 small breaths in with a larger breath out. Finally, you will end with 10 to 20 small breaths in with a very deep, forceful breath out. After performing this cycle, you will cough and excrete all mucus that has been built up in your airways.
Hello, my name's Tim, and we'll be doing percussion for little infants. So for demonstration purposes, we'll be using this Build-A-Bear. So for the first part, we're going to have you have your infant just sitting up like this, and ideally you'll be using this cup. We'll link the video below somewhere, but since we don't have that, I'll be just forming the cup with my hand. And so we're going to go under the clavicle, which is a bone that's just right here, and we're just going to cup, just percuss like that, just tap. And ideally we've been doing this for 2 to 3 minutes. And we can do that both sides, and you can, while you have them sitting up, you can do the same thing just on the back, like that. And another way is now we'll have them side lying, and you're gonna try to bring the infant's arm just right under the armpit, so you'll lift their arm up or have them lay them down, whatever's most comfortable for them, and you'll cup and side lying, but for demonstration purposes, you'll be doing this. And then lastly, you'll have them on their stomach, prone, and you'll just do the same thing with the cup or hands, and you just get them on the lower back to show the video like this. All right, and that's how you would do percussion on an infant.
Right. So what we're going to show next is percussion, but for an older adult here. So what we're going to do is that same thing he taught in the baby percussion, and really get cups with your hands, kind of like a V formation. And then when you're doing it, you want to get rhythmic with it and alternate your hands. So the first one we're going to do is sitting. You can lean back a little bit. And you want to go around clavicle line and just percuss right there. And have your patient cough throughout to make sure to clear any mucus from the airway. The next one we're going to show is a side lying technique to really get the side of your lung. So I'll have my patient come on the floor here. Once again, get your cups. And you go just beneath armpit level and just percuss right there. And then the last one is going to be on our stomach. I would advise to throw a pillow underneath around the waist level, mid-stomach, so that he can go and be more at a downhill. And then cups again and just rhythmically percuss there. Once again, have your patient cough, but do it safely and have him cough into his hands. Arms. And then you may see online that there's other positions you can put your patient if they want to percuss a different segment of the lung to really clear that segment, but we're just throwing the 3 basic ones of side lying, on your stomach, and then sitting to get the top part.
Alright, so you saw how to do percussion techniques for both infants and adults, and so you're probably wondering why we do it. And so we're doing these to break up pulmonary secretions, such as mucus, and just ultimately to clear out the airways.
Hello, my name is Christian Harris, and I'm a student here at HPU's DPT program. And today I want to teach you a little bit about exercise, and I also want to show you what exercises you can do whenever you prepare to exercise. So just a little bit on exercise and its benefits. Exercise improves heart function, lung function, sleep quality, and when done correctly, it makes you feel good. Exercise improves your heart function by increasing your heart's contractility and increases your blood flow throughout your body. It improves your lung function by increasing the quality of expiratory flow and inspiratory flow. It improves your sleep quality by just making you fatigued at night. And as a result of having better sleep quality, you have better immunity to diseases, and you have a better chance at fighting off infection because of increased amount of immunity. And it also makes you feel good. There's been research to suggest that whenever you work out, you get this influx of this neurotransmitter called serotonin, and as a result of that, you get an exercise high, or sometimes called a runner's high. Listed here, I have 3 or 4 exercises you can do at home, or 3 exercises you can do at home, and you can also walk around your neighborhood. Will help improve your chest strength, arm strength, and just generalized shoulder strength. So what you want to do is place your hands on the cabinet, slightly outside of shoulder width apart. You want to slide your feet back and perform a chest press. Alright, so the next exercise is called sit-to-stands. What you want to do, you want to get a surface or a seat or a couch that you can sit down on and stand up to very safely. With this, you want to start a little bit higher if you need to, or a little bit lower if you have the leg strength. So what you want to do, get your feet shoulder width apart, sit down, hinging at the hips, and coming right back up. Alright, here are some of the exercises that we reviewed today. Sit-to-stands, chest press, step-ups, and at the end of this video, I'm going to review walking. With each exercise, you want to do one set of 15 repetitions of each one. Same here and the same here. And I also haven't really discussed walking yet, but with any exercise or anything new that you've done before, you want to start off slow and build your way up. This is a concept that we refer to in physical therapy as graded exercise. So one day you may walk a quarter of a mile. The next day you can walk 3/4 of a mile. And then 2 weeks to 3 weeks down the line, you can walk anywhere up to 1 mile to 1.5 miles.
Thank you for watching this video. Hopefully you found it useful. From our High Point University family to yours, we are with you no matter where you're located. Stay safe.